Good morning, everyone. Welcome. We still have some people trickling in, but we're going to get started. It's great to see everyone and great to welcome you all this morning to the Fall Public Child Welfare Dialogue. My name's Alice Egan. I know lots of your faces and lots of you. It's wonderful to see you all this morning. I coordinate the Title IV program in the Sandra Rosenbaum School of Social Work. We're so happy that you took the morning to be here in person with us today. I know what it takes to get yourself out the door, especially on a Friday morning, and go somewhere in person. And it seems like now more than ever, it's really important to be able to do this and to come together to learn about and talk about things that are important to us and that sort of light a fire for us. So we're grateful that everyone's here, and I see lots of our current students, which is good because they have to be here, but also lots of our alumni and our faculty and staff and community members and practitioners. So it's really wonderful to see all of you here today. A couple of logistical things before I introduce our speaker, things you might be wondering about. There are sign-in sheets, so if you didn't sign in, please do, especially if you're requesting CEUs. CEUs will be emailed to you within the next week or two following this program. So you will receive your CEUs by email. There are restrooms. We're not going to take a formal break since this is only an hour and a half, but the restrooms are just outside this door and to the left. There's also more restrooms if you walk through the lobby and to your left. You will receive with your CEUs a very short 2-question evaluation. So we would love to hear your ideas for future dialogues and also what you thought about today's dialogue. So you'll get that in your email as well. Okay, so moving on to our main event. I believe this is our 43rd Public Child Welfare Dialogue. Many of those dialogues were created and run by my colleague Ellen Smith, who's here today, and you can find the recordings on our website if you're interested in going back in time and seeing all the speakers that we've had over the years. But today, we are very pleased to welcome Dr. Kathryn, or Katie, Maguire-Jack, who is here to talk to us about rural child maltreatment and child welfare practice. Dr. Maguire-Jack is an associate professor at the University of Michigan, and her research focuses on child abuse and neglect prevention with an emphasis on communities and geographic disparities. She's the faculty director of the University of Michigan Title IV program, the director of the Child Maltreatment Prevention Lab, and the faculty lead for the Welfare of Children and Families Pathway at the University of Michigan. Her work is funded by the Centers for Disease Control and Prevention. I'm trying to switch pages here. The United States Department of Health and Human Services Administration on Children, Youth, and Families, the Ohio Department of Children, Youth, and the Ohio Children's Trust Fund. She has expertise in advanced statistical methods and program evaluation. Excitingly, she received her BA, MPA, MSW, and PhD at the University of Wisconsin-Madison, so she is an alum. Dr. Maguire-Jack, we're really glad you came back to Wisconsin. Thank you for being here, and we're really excited to learn from you today. Welcome.
I'm flexible. All right, good morning. Can you hear me? Am I loud enough? Okay. Thank you so much for having me here. It's really an honor to be here speaking in Wisconsin. This is my home state. I'm originally from Winnebago County, Menasha, if anyone is familiar with Menasha. And as Alice said, I spent 12 years living here in Madison while I was doing a lot of different degrees. So really excited to be here. And it's also really an honor to be speaking to all of the Title IV students, those of you who are dedicating your life to working in child maltreatment and child welfare and helping children and families. It's a very noble profession, so it's really my honor to be able to speak with you today. For today, I'll be talking to you about rural neighborhoods and rural child welfare casework. This is an area that I'm very interested in. So when I was in my PhD program, I became very interested in geographic variation in child maltreatment. We're going to be flexible and you'll see me awkwardly stepping over there to switch slides. So I became really interested in geographic variation in child maltreatment when I was a doctoral student. I did my MSW field placement at the Department of Children and Families here in the state of Wisconsin. And I kept being in meetings hearing folks talk about how the rates vary so much from county to county. Everyone said that it was a fact, and they didn't have a lot of understanding as to the reasons for that. And so when I was in my doc program, I made a map of the state of Wisconsin, and I looked at the official rates of child maltreatment, and I found that the people at DCF were absolutely right. There was huge variation depending on where a family lived in terms of the risk for being involved with the child welfare system. I'll never forget, there were two counties up here in northeast Wisconsin that were right next to each other. They looked very similar demographically, and one of the counties at the time screened in about 93% of their child welfare referrals, and the neighbor screened in the opposite, 7%. And there was not really a clear understanding to me as to why that might be. So I became really interested in what is it about where people live that affect their likelihood of experiencing maltreatment or becoming involved in the child welfare system, understanding that it's probably a complex interaction of a lot of different things, but really that was a formative experience for me. So we see this variation within the state of Wisconsin, but we see it all around the country as well. So you can see there's significant differences in the number of children that get referred to child welfare agencies. So this is a map. Sorry, the colors don't look that great. But as you can see, this is child maltreatment rates per 1,000 children by quartile. And so we have the gray states you can ignore because there's no data for this year that I ran it. But the pink states are those that have the highest rates. The blue, the teal is the lowest rates. So in 2020, Hawaii had the lowest number of referrals per 1,000 children, which was only 18.1. So 18.1 per 1,000 children in the state of Hawaii were reported for suspected child maltreatment. And then we compare that to the state of Vermont, where there was almost 10 times that number of 137.7 per 1,000 children. And so do we believe that things are that vastly different between Hawaii and Vermont? Of course, there are very significant differences between those two states, but it triggers for me a scholarly interest in understanding why we see this. So in addition to the referrals to child welfare agencies, we also see significant differences in the substantiation. So this is, all of you in this room are very aware, but after you go out into the home and see what's going on and then make a decision whether to substantiate maltreatment or not. And as you can see here, this is again quartiles, but we see very significant variation in the number of substantiation by state. So on the extreme end of things for Pennsylvania, they had a low of 1.7 per 1,000 children who were substantiated for child maltreatment, compared to the state of Maine that had 10 times that number of 19 per 1,000 children. So why do we see these huge differences, and what is contributing to that is something that I have spent the last 20 or so years trying to uncover. So I became interested in these neighborhood effects. So in my dissertation, I looked at child welfare practice and decision making, but I was also interested in the things about where you live that affect your likelihood of maltreating. So not just the practice differences, but also the differences in the actual levels of child maltreatment. So I'm very focused on looking at rural areas at this time. This is an area that I became very interested in because we see higher rates of maltreatment happening within rural areas. If you look nationally or within states, we do see higher rates of child maltreatment in areas that are dubbed to be rural. But we see very little research trying to uncover why this is or understand differences between rural and urban and suburban areas to understand the different predictors. And I'm very focused on prevention, so trying to understand what we can do to try to make a difference, really forces us to try to understand the real causes of maltreatment. So for rural areas, we know that over 13 million children in the United States live in rural areas. It tends to be an overlooked population where there's not a lot of resources that are delegated to the rural areas. And we also know that child maltreatment rates in rural areas actually exceed the rates of urban areas once you consider population. Of course, the sheer number of urban children who are maltreated exceeds the number of rural children who are maltreated. But once you look at per the population and you look at the rate of maltreatment, it is actually higher in the rural areas. So these numbers are from NCANS, which is the National Child Abuse and Neglect Data System. So this is nationally. About 60 out of 1,000 rural children are subject of a child maltreatment investigation compared to 40 out of 1,000 urban children. So we do see stark differences. So what is it about rural areas that might be contributing to this difference? We know that poverty rates are higher in rural areas than they are in urban areas. And we also see higher rates of intergenerational, very little movement on the poverty rates within rural areas. So we see a lot of deep, deep poverty that is not changing a lot over time. Child poverty in particular is higher in rural areas. They often suffer from long-term poverty with very little opportunity to get out of such situations. And we know that discretionary rural federal funding is only a fraction of what the urban federal dollars are that are received. Get my steps in today. So in addition to poverty rates, we also see that there are, probably no surprise to anyone, but we have fewer services available in rural areas for families. So only about 10% of physicians in the United States practice in rural America. 75% of small rural counties lack a psychiatrist, and 95% lack a child psychiatrist. So that's a huge missing piece for folks who are living in rural areas. About 20% of non-metro counties are without mental health services compared to only 5% of metro counties. And in urban areas, we have about 17.5 pediatricians per 100,000 people compared to about 1/3 of that, 5.2 pediatricians per 100,000 people in rural counties. We also have fewer specialists available for specific disorders and issues that children might be facing. There's a lack of public transportation, so we have fewer services, they're farther away, and there's not an easy way to get to them. So that's another challenge. We have these long distances with challenging terrain. It's often not going to be just easy highway miles. There's often challenging terrain, especially in the state of Michigan. We have more dirt roads than I've ever seen in my life. But we have lots, so caseworkers are facing that, families are facing that. Folks often have to travel for training if they're caseworkers or foster parents or to visit their children. There's challenges in linking children to specialists, medical assistance, consultation, collaboration, and respite care. We have fewer services and they're farther away, so getting to any of these things are more difficult. Caseworkers in rural areas often complain about uncompensated travel time, that they don't have a reduction in their caseload size despite having to travel hours to get to the families. And there's a high degree of isolation reported by families who live in rural areas. And we know that social support is a big protective factor against child maltreatment, and being socially isolated is a big risk factor. So we see, especially among younger people who live in rural areas, because the population demographics are such that older families or older people in rural areas tend to stay longer, younger people tend to leave, and so the younger people with families who are left behind are often very isolated. So I mentioned that there's variation in the state of Wisconsin at the county level. That's not unique to Wisconsin. We see that all over the country. There's variation at the state level, but there's also variation all the way down to the census tract level. So this is the state of Michigan. The colors are not showing up super great, but yellow is where we have the lowest rate of maltreatment per 1,000 children, and the dark blue is where we see the highest rates. So this is showing you that the child maltreatment rate ranges from about less than 1 per 1,000 children to about 86 out of 1,000 children, excuse me. So practice differences that I talked about before in terms of child welfare decision making don't explain the differences at this level of geography. So Michigan is a statewide child welfare system. I know that Wisconsin is quasi, with it being mostly a county-based system. Michigan, we do have regions, but this is happening within the regions. We see these big differences. So neighborhood structural characteristics are one of the things that folks who study neighborhoods and study different things about geography look at in terms of what's predicting different social problems. And so neighborhood structural characteristics, this comes out of social disorganization theory, which is from Sean McKay in 1942. I do want to mention that this theory has been very criticized of focusing on very negative things and not considering structural, we talk about them as structural characteristics, but we're looking at things like poverty and residential instability, but not looking at things like systematic racism and those types of structural issues. So I do want to mention that, but this is the theory that is often applied. And so they originally proposed this theory to look at differences in juvenile justice rates and juvenile delinquency in Chicago neighborhoods. And the three things that Sean McKay looked at were concentrated disadvantage, so poverty, single parent households, residential instability, so people moving in and out of different neighborhoods, and then ethnic heterogeneity. This came out in 1942, so they were actually largely looking at different populations of Eastern Europeans and different enclaves within the city of Chicago. And then child maltreatment researchers have applied this theory to try to understand whether we can predict child maltreatment variation. And they have added this factor called child care burden, which is a little bit difficult theoretically to understand for me, but they look at the ratio of children to adults, the ratio of men to women, the ratio of adults to older adults, with the idea that if there's more children around, potentially it's hard for me to decide if it's a protective factor or a risk factor. They would argue that it's a risk factor. And then proximity to services has also been added as a structural characteristic of neighborhoods related to child maltreatment. In terms of what the research shows, concentrated disadvantage has been found to, over numerous studies with numerous populations in numerous places, has been found to be related to child maltreatment. So living in a place that has higher rates of poverty and inequality above and beyond the impact of being poor yourself increases the risk for child maltreatment. That it increases the risk for involvement with child welfare systems, but also self-reported maltreatment behaviors. So not just the interpretation by a child welfare worker, but what the parents are saying themselves. So there seems to be something about the experience of living in a place where people are disadvantaged and lack of opportunity that increases the risk for child maltreatment. Residential instability, I put in italics because it's tenuous. So some studies do find a relationship between residential instability and other studies do not. So that one is not really decided at this point. And then ethnic heterogeneity, I put an X through because by and large the child maltreatment research has not found a relationship between ethnic heterogeneity and child maltreatment. What we do see in that space is that children who look different from the minority or from the majority population within their neighborhood are more likely to be reported, but there isn't something at the population level in terms of the percent of different groups living in an area. with the exception of one study that found a protective effect of a larger proportion of Latino residents living in a neighborhood. But most studies find no relationship. Childcare burden is another one that is tenuous, where it's sometimes found to be a risk factor and sometimes not found to be a risk factor. Proximity to services is one that has definitely been found to be protective. So living closer to social services or child care centers tends to be protective for families against child maltreatment. All right, so neighborhoods and the way that it affects you is not just the amalgamation of the poverty rate. It's not just a count of the individuals that live there, right? There is a really important piece to neighborhoods that's the process that happens within them. The interactions that you have with other people matter. And so neighborhoods are not just a collection of census data, interactions happen within them. So the bonds that you might have with somebody could be very protective for you if you have people that you trust, if you have people that you can go to. So collective efficacy theory comes from Sampson in 1997, also out of Chicago. So they looked at social cohesion and informal social control. This is another theory that has been critiqued for not focusing enough on structural disadvantage. But what they have looked at with this theory, social cohesion relates to the trust and bonds that you have with the people in your neighborhood. So do you feel like they share the values that you have? Do you feel like you could rely on them if you needed a small favor, if you needed childcare? Do you have someone that you could call to bring your child to school so that you can go to UW to give a talk in the morning, right? So those are the types of things that social cohesion would capture. Informal social control is related to the likelihood that your neighbors would intervene if they saw a problem happening in the neighborhood. So this is not calling the police to intervene, this is intervening yourself. If you saw a fight break out in front of your home, would you step outside and do something? If you saw kids loitering on a corner in the middle of the school day, would you step out there and say something to them? Or do you think your neighbors would? So that's informal social control. In terms of the child maltreatment literature, so this is another one that was not created to describe child maltreatment, but has been applied to trying to understand child maltreatment. And social cohesion does seem to have a very protective role against child maltreatment. So in neighborhoods that have high rates of concentrated disadvantage, which we have seen to be a risk factor, high rates of social cohesion is a buffer against that. So if we have high rates of people depending and relying on each other, it does seem to buffer some of the negative impacts of the concentrated disadvantage. And it also is a promotive factor. So the difference between protective and promotive, protective means it would buffer against a risk, but a promotive factor would mean that it's helpful for everyone, even if you don't have the risk. So even if you're in a neighborhood that doesn't have the risk factors, it's still helpful to be living in a place that has high social cohesion. Informal social control is another tenuous one. So this one is not as straightforward when it comes to child maltreatment in terms of how it would work. So when you're thinking about juvenile delinquency, you think that informal social control might be helpful because you're interfering in exact instances of juvenile delinquency. So kids are spray painting graffiti and you think your neighbors would go in and stop them. So that's straightforward. But when you're applying this to child maltreatment, it's a little bit more tenuous in terms of, would it be protective because you feel safer that you live in a place where people would intervene if they saw a problem? It could also be that you are less likely to maltreat because you're worried that your neighbors might call Child Protective Services if they see you maltreating. So it's a little bit more tenuous, and it is sometimes found to be protective, but not always. So that's the general lay of the land in terms of the research related to urban neighborhoods and child maltreatment. So what about rural areas? So I was really interested because we know the pieces of information that I just told you to be true, we know that that's true in Chicago and Los Angeles and Columbus and New York City, but there has not been research to look at how these same types of neighborhood factors might impact maltreatment in the rural areas. So there's very limited research on rural maltreatment writ large, but when it comes to understanding rural neighborhoods and child maltreatment, there is almost nothing. So we really don't understand how these things might be different. And I very naively, as most researchers start things, like just went out and tried to do a survey of rural families in the state of Ohio. And we started talking to them and asking them the questions that we ask for collective efficacy. And so we said, do you think your neighbors would intervene if they saw a fight break out in front of their home? And they said, that would never happen where I live. No one would see it. If a fight broke out in front of my home, there would literally be no one to witness it, so I don't know how to answer your question. And that was a big learning moment for me. Like, we don't even have the right concepts and the right questions to ask to understand how these things might be playing out. So I really have spent the past 6-7 years really trying to focus in on the rural neighborhoods to understand what might be going on there, what might be protective for them. I'm very interested in prevention, so using this information to be able to provide a program that will be useful or a strategy that will be useful is very important to me. So what does it mean when your neighborhood looks like this? Your neighborhood, I put that in quotes, because is that even the right word? Does this concept even translate? Does it make sense? So when your nearest neighbor is all the way down, a mile down the road, do these things play out in the same way? So this is just the citation. It's under review right now. Hopefully it'll be published very soon. And I'm happy to provide these slides after if anyone is interested, just because I know I'm flipping through them quickly. So for this study, it's a quantitative study where I was trying to look at rural child maltreatment. And what I wanted to do was take the urban lens and apply it to the rural areas to see, do these things map on in the same way that we see happening in the urban areas? Do the same things matter in rural Michigan? So we looked at neighborhood disadvantage, childcare burden, and neighborhood turnover, and we wanted to see if they were correlated with each other, the variables that make up those factors, if they were correlated in the same way. And then we wanted to see if those things related to child maltreatment in rural areas. So we looked at child maltreatment substantiations occurring in 2019 per 1,000 children. 1,000 children in the census tract, and we used MySACWIS for this. That's the name of our SACWIS system. I know yours, at least when I used to work in state government, was EWIS-SACWIS. I don't know if it still is. But ours is MySACWIS, and the independent variables that we looked at were poverty rate, unemployment rate, female-headed households, percent recently moved into the area, percent vacant homes, percent over 65, and percent under 14. So these are trying to get at, these are the variables that are commonly used to look at those three factors of concentrated disadvantage, residential instability, and child care burden. So to do this, we did some mapping of child maltreatment rates. I already gave you a preview of that maize and blue map of Michigan that we're going to dig into a little bit more. And then we did a principal components analysis, which is, you don't need to know the ins and outs of any of these methods, but that one just allows you to see if they hang together in the same way, and it'll make more sense when I show the results. And then negative binomial regression is just what we use to see if the same things predicted maltreatment in rural areas as they did in urban areas. Okay, so here's the map of Michigan again. So I know you're all familiar with the UP living here in Wisconsin. By the way, I agree with you, it should be part of the state of Wisconsin. It's weird that it's part of Michigan, but so as you can see in the UP, so the upper northern half of the lower peninsula is very rural, and then the entire UP is very rural. There are pockets that are not, but the vast majority of it is very rural. And as you can see, we have significant variation where we have in the upper half of the lower peninsula, we have very high rates of child maltreatment. So these are rural areas that have very high rates of maltreatment. But in the UP, which is in the same region as the upper half of the lower peninsula, we have very low rates of child maltreatment. So that really piqued my interest, like what is so different about the UP compared to the northern part of the LP. And so trying to understand some of those neighborhood factors was really interesting to me. So this is the findings from that principal components analysis that I talked about. And again, you don't need to understand like the ins and outs of it. The key important pieces is that this is just putting all of these variables in to see what hangs together. And so on the left-hand panel, you see metro census tracts, and then on the right-hand panel, making sure it looks the same on the screen, is the non-metro, so the rural census tracts in Michigan. And what we see in urban Michigan is very similar to what we see all across the country. So we have things hanging together related, so poverty, unemployment rate, percent female-headed households, those are all hanging together. And that is a very common factor that's found in urban areas that we call concentrated disadvantage. Then we see one related to childcare burden. That's that second one where it's percent under 14 and percent over 65. And then the third component is related to the moving in and out of the neighborhood. So new people coming in. And I don't know if I said this before, but the reason that they think moving in and out of a neighborhood could be related to maltreatment is because of the inability to make bonds that I was talking about in terms of social cohesion. So if you're always having new people there, you don't have the ability to make the connections that you might be able to if you have the same people living next door. So as I mentioned, in the urban areas, we see that female-headed households cluster together with unemployment as well as poverty. And what we see in the non-metro or the rural areas is that lower rates of poverty and unemployment actually cluster together with residential instability. So we don't see this percent female-headed households clustering together with poverty in the same way in urban areas as we do in rural areas. So the reason for that is, we believe, is because poverty, so poverty and employment rates were very similar actually across rural and urban Michigan, but the percent of female-headed households was roughly half in the rural areas. So we see high rates of poverty and unemployment across all types of families, not just concentrated within the single-family households. And then we also see poverty and unemployment clustering together with high levels of turnover. So there is a tendency of younger people to leave rural areas, to move to urban areas where there are more job opportunities. And then we see a higher concentration of older residents in the rural areas. And older residents are not counted in the unemployment numbers if they're not seeking employment. The unemployment numbers only count people who are actively seeking employment. So we think that could be why. Okay, so then this is the negative binomial regression, which is just looking at how the different issues relate to the child maltreatment rate. Okay, so I've highlighted the ones that are different. So we can see that the poverty rate across urban and rural is almost identical in terms of its impact on child maltreatment. So that seems to be a characteristic that is uniformly a risk factor for higher rates of maltreatment. In this case, it's for substantiations, so a higher likelihood of being substantiated if you live in a census tract that has a higher rate of poverty. Unemployment, interestingly, had a negative relationship, so a protective effect in urban areas, and was not significant in rural areas. I was really perplexed by that, but it actually coincides with findings in national data that unemployment rates were related to actually lower rates of maltreatment. in urban areas. But we think that this potentially could be because in a rural area, if you face unemployment, it might be a much more stressful event because of the lack of opportunity and the much more difficulty in finding a new job. Vacant housing units and percent moving was related to more maltreatment in rural tracts, but not in urban tracts. So this is something that was particularly interesting to me because we've seen in the prior literature that residential instability is sometimes related to maltreatment and sometimes not. What we're seeing in Michigan is that it is related to higher rates of maltreatment in the rural areas, but not in the urban areas. And so we're not sure of the reason for this. One hypothesis is that when we have folks leaving rural areas, they're much less likely to be replaced by young families or other people that look like them. So in an urban area, you might have people, the neighborhood turning over, but you are having more young people move in and other people that you can make connections with, whereas in a rural area, you may not be having people move back or replacing the population. Just checking my time. Okay. So the implication of this is that much remains unknown about neighborhood factors and child maltreatment in rural areas. What we know about urban areas doesn't necessarily apply. The questions that we ask, the frameworks that we're using may not be the right ones, and so there is a very significant need for in-depth qualitative inquiry. So that's my next part. Is everyone still with me? Okay, this part might be a bit more fun because it's qualitative, so it's like about what people actually said about things instead of just numbers. So these are the references for the 2 publications that have come out of this so far, but we did interviews with 26 rural parents living in Livingston County, which is, it's a mixed county. There's some rural areas and some urban, or some rural areas and some urban areas, but we only talked to the parents that self-identified as rural. So we specified that you don't live in a subdivision, that you consider yourself to be rural. So we found parents, it was a very significant undertaking to get rural parents to agree to be interviewed by my research team. So we tried multiple different strategies and they were mostly unsuccessful. So I had a community-based mental health provider handing out flyers and nobody called me. I had home visitors handing out flyers and nobody called me. So eventually we went to Facebook, and I live in Livingston County. And so I was able to go on and say, like, hey neighbor, I'm a professor at U of M and I would love to talk to you about your experiences, or have my students talk to you. And then they were able to trust and agree to do it. Like that was, we figured out that that was a big issue. So just handing out a flyer and promising people a gift card was not enough. There had to be some sort of personal connection. So we did that in the summer of 2021, which means that we did them all by Zoom. And I really wanted to understand, you know, we had the Ohio data that showed that the questions didn't make sense, and we had the Michigan SACWIS data that showed that some of these things are different. And so I really wanted to understand, how do parents think about these things? How do rural parents think about their neighborhood? Do they even use that word? Does that word make sense to them? Do you say, I live in a neighborhood or not? If you live on a long highway road, a mile away from anybody else, do you still think about living in a neighborhood? So we asked them questions about that. One of the exercises that we did that I thought would be really interesting and enlightening was pulling up on Google Maps their address and asking them to put the boundaries around what they consider to be their neighborhood. And that was another exercise that flopped because they were not, it didn't translate to them. It didn't make sense. There wasn't, so they would opt to just say, just put a circle around my house and we'll call that my neighborhood. So that I learned a lot from that as well. So many people did not use the term neighborhood. They were more likely to use the term community, like the community that I'm from. And when we asked them what the community was, they would talk about their entire town. The town that they lived in was their neighborhood. So that was really interesting. And then we talked to them about what kind of assistance they receive from their neighbors, what they rely on them for, what it's like being a parent in rural areas, what they provide to their neighbors, whether they think child maltreatment is a problem, whether they would intervene if they saw child maltreatment or were aware of child maltreatment happening, and whether they thought their neighbors would. So that was the purpose. So we have these two publications off of it. One is really focused on the parenting support, and one is really focused on the child maltreatment responses. So what we found was that 16 out of the 26 parents reported that they received some level of parenting support from their neighbors. So there was some level happening. They talked about reciprocal childcare assistance with neighbors. So my kids can go to your house for a play date, and next weekend yours can come to my house for a play date. They talked about that being really helpful to them. 11 participants mentioned that their neighbors keep their children safe. So an example of that is they said, well, I rely on them. When my kids are outside, I kind of have an expectation for them to keep an eye on my children, such as if my neighbors are driving, to keep an eye on my children because they're running all over the place with their bikes and whatnot. So there wasn't often like a specific example that they could give that say, this is how they keep my children safe, but there was more of, I expect that they will, I trust that they will. So that was one finding. But we also had a lot of parents talk about not receiving a lot of parenting support and feeling very isolated. So 14 out of 26 reported that they felt some level of isolation within their community. So one participant said, I'm hoping that when my daughter starts school and she makes friends, maybe I will find some support in other moms there. But right now, that's not where I want it to be. So people talked about feeling different from their neighbors, and some other pieces that we'll get into in a minute. One of the big ones was not knowing anyone in their community. So not knowing who even has children, thinking, I don't know their names, they probably don't know my name, they don't know if I have children. So one participant said, I would say that they don't even know we have a child. There's so little interaction. I wouldn't even know if I passed them on the road. I don't know what they look like, and they don't know what I look like. So they really reported, this is in contrast to what the sort of rosy ideas that people have a lot of the time about rural areas where everybody is close-knit and friends and they all rely on each other. People are feeling really isolated, which of course was exacerbated by the fact that it was 2021. People did talk about COVID a lot. Other people said that they thought their neighbors were unhelpful. I don't think neighbors in this area know each other well enough to step up and offer help or offer assistance. They also mentioned the physical or built environment within the area that they live as being an impediment to being able to have those types of interactions. So dirt roads, lack of parks, increase the inability to make friends. So one person said, we can't just walk to a playground. I guess it's more environmental things. We don't have that readily available to us. We'd have to drive somewhere to take them to a park or to run around. That really resonated with me because I remember as a parent of a young child living in Verona, when things got really hard and my toddler was like really driving me crazy, we would just walk down to the park and I could let him run and I could see other humans and feel more normal. And it was really a good opportunity to make friends, but also just to provide a little bit of respite. So I thought that was really interesting. Most parents from these rural areas stated that they rely on support systems for parenting outside of their geographic neighborhood, that they're really not relying on their neighbors for these things. These are people that are relying, 18 out of 26 said their extended families who might live far away, but they can still reach out and rely on them. Their friends that don't live in their direct neighborhood, or 4 out of 26 specifically mentioned their church. So one person said, out here, we're way too different than anyone around here. So there was a feeling many people talked about politics and feeling like because I identify in this way, or because my child identifies in this way, or I'm in this type of relationship, I'm not accepted, I'm alienated, and I don't even want to try to engage. Another person said, we have friends that are not living close to us that we spend time with. We don't have that bond like you would associate with in a neighborhood. It's really interesting because there's a lot of people that anecdotally talk about rural areas as being this very 1950s sunny, like everybody knows each other and they rely on each other. And the people that we talk to in the rural areas have that same stereotype about urban and suburban. So they're saying like, oh, well, when you live that close to each other, then you automatically have a bond. So I thought that was an interesting juxtaposition, because I think both places are kind of romanticizing the other. Okay, so then the second study was looking at how, from this same data set, looking at how neighbors would intervene if they saw child maltreatment happening. So one of the exercises that we did was to show them these pictures and say which one looks most like where you live. And so we had like the most rural was in A, and then B was still rural but like closer together, and then C and D were the people that we were not intending on including because they were not what we described as a rural area, but we did have one C sneak through. So she participated and said that C looked most like her neighborhood, but we had 0 that were in D, which is the most urban. So we did have 1 suburban. And, okay, so then we compared how their neighborhood looks to their likelihood of intervening. So we asked them a variety of questions on whether they would intervene if maltreatment was happening. We gave them scenarios that were happening and asked them if they would intervene. And so we had we had 15 people that were in neighborhood A, so the most rural, and 33% of them said, yes, I would intervene. 40% said they'd be pretty hesitant to intervene unless there were certain circumstances. And then 27% said some mix of both. So they said some things, yes, I would definitely, some things I wouldn't, but it was some mix. 8 people lived in the closer rural areas, neighborhood B. And we had 25% who said they definitely would intervene no matter what. 25% said probably not, very hesitant, and then 50% said some level of both. And then in neighborhood C, the one individual said that she 100% would intervene. So it's obviously this is qualitative data, and we're not trying to fit a regression line, but it is an interesting trend that the closer together they live, we see a higher willingness to intervene or a greater likelihood to intervene. So what did this mean? So for would intervene, we had 2 different sub-themes under this, and the first was interpersonal agency, which was talking to the neighbor. If the child was in danger at that moment, actually removing the child yourself and taking the child to your home, or engaging your neighbors in collective action if something wasn't changing. And then the other one was utilizing authorities. So 10 out of 24 participants said that they would talk to the neighbor directly or intervene themselves. And they said, if I do see a child being mistreated or something, for me, I'll have to speak up because I feel like that is not right, and I'm going to try and talk to their parents. 13 out of 24 said that they would be more likely to call an authority, and the people that they mentioned were police, Child Protective Services, or the schools. We had several participants saying, like, I would call the principal and tell the principal that this was happening, which was not something I expected. Was interesting. So we see under the hesitant to intervene, so these are parents who said probably not, or only under very extreme circumstances. So the first sub-theme under that was a culture of silence. So 7 out of 24 participants mentioned something related to this culture of silence. So there's a few different quotes here that kind of get at this. The first was, there seems to be a culture of kind of what happens at home stays at home. The second one, I think my neighbors probably would not intervene. Again, very old school. Like, that's kind of that country mentality, unfortunately. And then the third one was, there's a lot of things I disapprove of, but that wouldn't be my business. So these are all different people talking about either their neighbors wouldn't do something or they wouldn't do something themselves because of this culture of privacy, allowing people to keep what's happening in the family to themselves. The ecological barriers that came up in terms of isolation and inability to receive parenting support also came up in terms of child maltreatment detection. So 4 participants mentioned something related to this. One said, I don't know that we would necessarily see that happening just because of the distance between. I mean, even if I was driving by outside, I wouldn't know the whole situation. And then the second one, unfortunately, no one's close enough and I wouldn't be able to see a kiddo on a day-to-day basis to see if they had any kind of signs of abuse. So really just saying, we're so far away from each other, we don't see each other, so I really wouldn't know if that's happening. And then under this hesitancy to intervene theme, there was also this, unless it was a very severe case. So this person said, honestly, unless it was a flat out beating them, I don't think anyone would intervene. If I just didn't like or didn't approve, if they were being nasty to their kid, I probably won't do anything. And I don't think any of my neighbors will do anything either. So unless they're seeing something very severe happening, they're reporting that they wouldn't say anything and they don't think their neighbors would either. So what does this tell us? What do we take away from this? There seems to be mixed feelings from rural residents on the helpfulness of parents within their geographic proximity. That's not surprising. People are different, right? One of the limitations that I want to mention of this sample is that the way we ultimately got parents was from those Facebook neighborhood groups. And so we have a sample bias of people who are automatically more connected than other people because these people have internet connectivity and they are reaching out and connecting with neighbors in that way. Unfortunately, it was the only way we could get a sample for this small pilot study. But even within that sample of people who are more connected, they're reporting feeling very isolated and not receiving a lot of help. Most agree that there's a culture of keeping to oneself and that the built environment makes offering and receiving parenting help, including detecting child maltreatment, harder. So then for the third study that I'll be talking about, this is where we actually talked to the rural child welfare caseworker. So we wanted to supplement the data from parents with talking to caseworkers. So these were child welfare caseworkers in that northern part of the Lower Peninsula and the Upper Peninsula. So we talked to 28 child welfare workers in rural Michigan. This sample we got from the State Department of Health and Human Services sent out a request to all of the employees. And then they had a little Qualtrics survey where they could provide their information to us so that their boss didn't know if they participated, and then we reached out to them. So it's much more, it's a less biased sample. It's still going to be biased in terms of the people who agreed to talk to us are going to either be super loving their job or super hating their job and wanting to talk to someone about it. But a better sample nonetheless. These are preliminary results. We haven't completed our analysis, so this is like hot off the press, still on the press. This is not published yet. But we talked to the caseworkers about the differences between urban and rural child welfare case practice. We talked to them about their understanding of the characteristics of rural communities, the strengths and barriers of rural communities, and then the experiences of doing child welfare casework in rural communities. Most participants reported that we asked them what drew you to want to work in child welfare in a rural area. Most of them reported that it was going back home for them. So they had grown up in a rural area and they work in the community in which they grew up. So the caseworkers identified several barriers to child welfare services in rural areas. So they mentioned limited prevention services. So this coincides with what we know about rural areas everywhere, but we do see the limited services, limited access to them. They noted that there's high rates of poverty and high rates of multi-generational maltreatment. Families that have been involved with the child welfare system as children, growing up to become adults and being involved themselves, and the cycle continuing, they reported that they see that. And then the last one that they talked about was windshield time, which is a phrase I had not heard before, but it's how much time they're spending in their cars driving between different cases. And so they said travel time, distance, getting to them, especially for that emergent response, that's a huge struggle. We cover 3 counties, and so when we're on a call, if I live on the far end of one county, if I have to get 2 counties over, it could take me up to an hour and a half to 2 hours to get there. So if you think about an emergency situation and a person having to wait 2 hours before they're able to get there, they reported that that's a struggle for them. Another issue that they reported was confidentiality and the connections between caseworkers and clients. So this one I think is really telling, but keeping in mind that everyone's related to everyone almost, so the confidentiality piece is really important. I think that's another piece that a lot of people don't understand. I'll go out on cases and I'll be like, oh yeah, that was my cousin's best friend growing up. Investigating cases or families that you are connected to in different ways. This caseworker mentioned to be a challenge, and they have very few caseworkers, so the ability to pass it off to someone else is difficult, and the likelihood that the person you would pass it off to is going to have some other kind of connection to this family is another challenge. So that was really interesting. Another one is bypassing of formal channels. So they said that the families, because they're so connected to different people, that they might try to bypass the child welfare system. So they said, if so-and-so's brother is a deputy, so we're just gonna call them and they'll get their brother and we'll just handle it like backdoor style, which is a huge thing that we are really trying to make the community aware of, that that's inappropriate and it needs to be reported through appropriate channels so that the family can get the appropriate support. So they were really talking a lot about this, and it makes me think back to when they called the principal instead of Child Protective Services about a concern, but like really trying to, and I'm not putting a judgment on it either way, because potentially if they have really great prevention services provided through there, maybe that's an option, but this caseworker is reporting the real concerns about child maltreatment that are happening that are not getting reported. Another barrier that they mentioned was a distrust of government within the rural areas. So this person said, well, you're just here because the government put you in. I have my rights. And then they go spouting off about 15 different amendment rights that go along with why they don't need to work with this service or why this service worker isn't able to be on their property and things like that. This same caseworker talked about the culture of guns in the Upper Peninsula, and she mentioned families like showing them their gun collection while they're there and telling them that they don't have a right, like really providing some sort of unspoken threat that was perceived by the caseworker. So barriers to accessing services at large, this is not just child welfare, but services in general. Similar to what we have seen in the research literature, the caseworkers reported that there's huge wait lists for the different services that their families might need, that there's no openings, that they have staff shortages at the other services, but also in child welfare, the lack of access to technology for parents. So things like telehealth and things that we've seen proliferate since COVID as being the solution and be all end all for families in rural areas is not working for everybody who doesn't have access to the type of technology. transportation and competing for resources. So they also mentioned how this isolation and transportation can all kind of come together. So this quote says, if they don't have people that they can fall back on, there's not much else to fall back on. We don't have a shelter, so if you're homeless, you're homeless. And if you don't have a family member to go to, you're in a tent. Or you have to trek a good distance away to get to a shelter, potentially to get in. We did have a number of caseworkers talk about families that were like living in campgrounds or different situations like that that were really just the solution that was happening to homelessness. They also talked about strengths, the unique strengths of rural areas. So they mentioned family orientation being a strong value within the rural areas. So they said there's a lot of family orientation. You have a lot of generational families living here. So a lot more close-knit family connections versus if you're in the more urban area or in one of the suburban neighborhoods, chances are you're not going to have a family member living right next door or a mile down the road, to whereas up here we have a lot more of the multi-generational sense of family and grouping. So in this sense, they were talking about this as a strength of the rural areas. Then we asked them to speak about their perspectives on the casework itself. So the participants described some unique strengths. So in addition to the barriers that they focused a lot on, they talked about having a strong rapport between families and the child welfare workers. So we see sort of a both and, where there's a lot of tension in some cases between the child welfare workers and the families, but then in other cases there being really strong rapport. They mentioned cooperation between community partners. They talked a lot about that as a strength in terms of, in an urban area, if you're calling a service provider, they may or may not know you. It's probably just a very specific process that they follow to get you in, get your client in for services. But if in a rural area, that community provider might be your cousin or someone you went to high school with. And so you can call up and they might be able to move your client up to the top of the list in a way that is likely to. So it was talked about here as a strength, but it should also be considered the ways that might disadvantage some families, right? If you're skipping the line for families that you like. So it really depends on which part of the equation you fall in there. And then provider continuity, they said there's a lot less people you end up interacting with because there's less providers. It's a lot easier to coordinate with different counselors in the area or different service providers to build connections. So because it's going to be the same people, it's easier, they reported, to be able to make connections with them, have them know you and you know them in order to make those handoffs. In terms of the close-knit communities, the caseworkers mentioned that it's both a strength and a challenge. So they said, I do think that there's a really great strength in how well-bounded a community like these communities are. Chances are people know people's names and are able to, if they know a family is struggling or if someone is going on, usually there is a sense of self-sufficiency or at least interconnectedness because of how small the communities are. So suggesting that they know each other, they're willing to step in, everybody there's more of an opportunity to rely on each other. At the same time, another caseworker said, it helps for the wrong reasons that people are afraid of what others will say or think, because when there's less people, it's a lot harder to hide. So what this caseworker in the larger context of the quote was talking about was difficulty or an unwillingness to reach out and ask for help because you're going to know all of those people and they're all going to now know your business if you're having some sort of issue. Or you might know that these people, I know them from this other part of my life and they're not going to believe me. And so for a lot of different reasons, the lack of anonymity can make it more difficult to reach out when you're having stigmatized problems. Then in terms of the casework, almost all participants reported experiencing burnout at some point in their child welfare career. This is a real issue that happens in child welfare. This participant said, "We're pretty much required to be available to our families around the clock. We're expected to work after hours if that's when the family can meet us." And so in the context of the long distances having to drive, this was a real concern for this child welfare caseworker. Despite this, we did see a huge commitment of the child welfare caseworkers in these rural areas. So you're all probably aware that turnover rates can be quite high in child welfare jobs. I didn't have a slide on the demographics because we haven't compiled that information yet, but we did look at how long the workers have been in those placements, and we do see that most of these workers have been there for 10 years, 15 years, much longer than you would anticipate in other places. So we do see a big commitment to the work. One worker said, "We come in and maybe they didn't want me there. Maybe I was kicked off the property and threatened every which way. But we get to the end of the case and they're making progress and they're thankful for the support and services, and they come around and say, okay, we did need the help and thank you for being there and enduring through all of these emotions." So I think that's the most positive. So feeling like once they're able to break through those initial barriers, that they are still able to make a positive difference for families has been making a difference for this caseworker. All right, so I'm coming to the end. So the takeaways from this talk that I would like you to have are that we do see official child maltreatment rates being higher in rural areas. We don't fully understand why. The research is not there. I've been trying to get funding from the National Institutes of Health to look into this further, and haven't been successful yet, but I'll keep trying, trying to get people to care about a smaller number of people compared to the urban areas can be difficult sometimes from a statistical power perspective. There are unique challenges and strengths to rural families and to the rural caseworkers. And I think it's really important for the training for caseworkers to consider context. So really equipping workers for the realities of what they will be experiencing in these different types of places. And the final conclusion is that your work is very essential and your work matters, and you will be making a difference for children and families. So at this time, I'm happy to take any questions that you might have. In the back.
It's not really a question, more of a food for thought. We work in a very rural county, and when you have the A, B, C, and D of neighborhoods, D, that was clearly a town, is still rural because with us, right? Because there's no access to services in our county. There's like 4 daycares in our county. You know, so there's, although they live right next to people in a town, it's still very rural, it's still very isolated, it's all of those things, because the nearest urban area is Malvern.
Right, right.
So,
Yeah.
just
Yeah, no, that's a great point. So I'm going to repeat it just for the sake of the recording. So there was just a point that in the pictures, the neighborhood D, I said we specifically had people not be from neighborhoods that looked like that because of what we were studying. And it is absolutely true that within rural areas, you do have centers where there's more population and look more like urban or suburban types of neighborhoods. For this specific study, we were really trying to get at distance from your neighbors and what it looks like when you're far away. So that's why we sampled in the way that we did. But absolutely, the same structural problems happen for people that are in rural counties, even if they're in more of an urban-like setting within the rural county. Absolutely, you're definitely correct on that. Thank you. Other questions or thoughts? Yeah.
Child maltreatment are very related. Can you break that down a little by types of child maltreatment or all of them?
the question is, if child maltreatment rates are higher in rural areas, did we break it down by types of maltreatment? That's a great question that I don't know the answer to off the top of my head. We certainly could, and it's probably published from the NCANS data. I suspect that similar to the urban areas, neglect is probably still the highest, but I don't know the answer to that off the cuff. What we hear anecdotally from the child welfare workers is that they see more cases of extreme physical abuse or sexual abuse because of the culture of silence and the reluctance to call, that when they are called, it's for something that's very severe and in your face, as opposed to neglect, which is much more nuanced. And in an urban area, folks might be more likely to call that in quickly, whereas in a rural area, it might go undetected for a long time. But that's just an anecdotal response to a really good question. So thank you for that. Yeah.
You said something about that Michigan is run at the state level, whereas Wisconsin, with the exception of Milwaukee, is run at the county level. Do you think there's a disadvantage in how Michigan does things being run at more so they're at the regional level? So when a worker has to drive 2 hours to get to a family versus like a county, I mean, I've certainly driven an hour in my county, but I'm making multiple stops on the way, and I'm sure plenty of people who work in larger area land-wise counties drive. But do you think that contributes to part of the problems with the maltreatment and stuff like that?
It's a really good question. So the question was, Michigan's a state system compared to Wisconsin that is mostly a county-based system with the exception of Milwaukee. And so the workers in Michigan cover a larger geographic distance because they cover a region. Within the regions, they do have sub areas that they cover, but it is very common for them to cover 2 to 3 counties compared to in Wisconsin, where you would only be covering 1 county because it's a county-based system. In terms of whether it contributes, as a researcher, I can't answer that question reliably or with any kind of confidence. But what I would say is that I think there's pluses or minuses to both approaches. I think that the highly localized approach can really meet community needs. When you have regions that have urban and rural together, the needs of the rural areas can be ignored in favor of focusing on where there's a lot more population and a lot more kids who are affected. So I think that can be a challenge. However, what I have seen, I was at Ohio State for 6 years before I moved to Michigan, which is another a county-based system. And what I have seen in both Ohio and Wisconsin is 72 different ways of doing things, which can contribute to vast differences in how things are approached and defined, even though the state tells you what the definition is, and then there's supposed to be uniformity in that. I have seen that not function well. However, within regions, we see the same thing, right? And so I would say there's pluses and minuses to both approaches. I think there are some economies of scale to having a statewide approach, especially a statewide hotline to call, where at least at that level everything is uniform. But this is just my personal opinion and not based on research that I have conducted. So, thank you. Yes.
You said that in the training of caseworkers, there should be attention to context for those going into rural service. Since we have students here and the School of Social Work, what exactly are you talking about when you say training about context?
Yeah, thank you. That's a great question. So the question is, one of the implications I mentioned was that it would be important to consider context when you're doing training. So in Michigan, I'm not familiar with the training in Wisconsin anymore, but in Michigan, we have one statewide system of training where everyone goes through the same trainings. And so there isn't anything specific about the types of, so when I mentioned things that caseworkers run into, they mentioned very practical things like if you're going out to a farm, like expect to see chickens and have to shoo them off your car, and goats and things like that, and be dressed appropriately for that. So that's a silly example of something. But additionally, like having information and training about the culture of guns and what they're allowed to do versus not allowed to do. Not that it never happens in an urban area, so that could probably be helpful to everybody. But to the extent that there are these unique characteristics about being really fearful of the government and really reluctant to allow you into the home, that would be the type of information. I haven't gone into it. We just conducted these interviews this summer, so I haven't gotten far enough down the line to think about like what that intervention would look like or what topics they would specifically cover. But looking at what the caseworkers are experiencing and reporting that they weren't ready or prepared for, I think is the type of information we would want to use to inform that. So, yeah, thanks.
Just curious about the racial demographics of the parents who participated in the military.
It's a great question. So the question is about the racial demographics. It was majority white women who participated, which is reflective of the population in Livingston County. We had, of the 26 parents, I believe 2 of them were fathers and the rest were mothers. And I believe we had one African American participant and the rest were white. But I don't know that for 100% certainty, but if it's not that, it's very close to that. So very little heterogeneity. Yeah.
Sort of makes me back about seeing criminal support, assessing criminal support, and gathering information about the kids around the area.
That's a great question. So the question is, we saw mixed information about whether you thought it was supportive or not supportive amongst the parents, and did we gather any information about how long they lived there? We did gather that information, and we didn't see a one-to-one relationship with it in terms of everyone who was newer said it was not supportive and everyone who had lived there their whole life said it was. But we did see several people who were newer reporting that to be an issue. Like there's this insider group that I can't be a part of, and we saw that same type of thing with caseworkers in terms of when they were talking about how helpful it is that you can call up your friend and move your person to the top of the list. If you're not a person who's a friend with that person, that could be a barrier because you're never getting moved to the top of the list, so it can affect your clients. So we didn't see like a one-to-one relationship, but we definitely did see people reporting that they all seem to know each other and I'm different and I don't fit in with them, and I can't break into that insider club. So that's definitely something that we see for sure. Thank you. Yeah.
Sorry. With the child welfare there was some longevity, but was there talk about the turnover for those people that were in the area? Or was it,
That we did not assess. So the question was for the people who, when we see higher rates of turnover, those who are leaving in the rural areas, were they newer to the area compared to the ones who are staying? That I don't think that we assessed. I haven't seen it in the data if we have, but it's a really good question that I'm sorry that we didn't investigate. I wish we had. Any other questions? Yeah.
characteristics you mentioned about the families, was that like multi-generational maltreatment seems to be common? Just want to clarify, do you mean like both elderly and child maltreatment happening at the same time, or like an intergenerational pattern?
That's a great question. So we use the term multi-generational to talk about, so let me rephrase the question first for the recording. When we say multi-generational child maltreatment is common in rural areas, are we talking about like elders elder abuse, or is that what you're asking? And child maltreatment happening at the same time, or are we talking about more intergenerational? And we are talking about more intergenerational. That's probably a better word for it, so thank you for that. That is what we're talking about, like children who were known to the system as children growing up and then being adults that are now involved in the system because of their own children and issues that they're having within their families. So seeing the cycle of maltreatment repeating and happening over and over again is what they're talking about. Yep.
I haven't checked over, probably I should, but if there's any evidence supporting such a rural urban differences intergenerational transmission,
That's a great question. So the question is, like, is it different? Is we see intergenerational child maltreatment happen in urban areas? Is it a higher trend in rural areas compared to urban areas? And I don't know the answer to that in terms of the research. This is what the qualitative interviews suggested, of them saying this is a big problem. But I would be willing to bet we would see the same theme come up in an urban area, that it wouldn't necessarily be unique to a rural area. But the workers thought that it was a particularly strong issue within the rural areas. Yeah, but I haven't seen research on that. It would be a really interesting question. Thank you. Yep.
So in thinking about the questions of interviewing and how to intervene, for system pieces or intervening to communicate if there was, something egregious that was happening to the child right there. I'm wondering if anybody had indicated that might reach out to the parent later to see if they were okay to have that kind of connection.
So the question is, when we're looking at intervening in child maltreatment, did any parents talk about intervening later? Like not in the moment to the parent, but following up with them later? Not in our cases. So we either got, I would call the sheriff, that's usually what they say instead of the police. I'll call the sheriff or CPS, or I would talk to them right then and there and confront them, or I would do nothing. Those were the real three things that we saw. We didn't see a lot. I don't think we had anyone say that later on I would check in to see if they're okay, which might actually be a more productive means when the moment has passed, but we didn't have anyone saying that. Yeah. Thank you. These are great questions. Thank you. I think we're done, Alice. Thank you so much.